Basically, the ones who have taken up their M.B.B.S, that is their basic graduate degree of medical, for them, it now becomes an option whether after doing finishing your graduation, whether you should take up a clinical surgical branch or take up a non-surgical branch. The surgical branch that I have chosen was the MS Orthopedics, and that usually involves a 3 years of training here in India for your this thing, and you become a postgraduate MS Orthopedic qualified. Now, after finishing my MS Orthopedics, the trend was not that much to take up a more of a super specialization. But as we have been seeing in the last 5-10 years in India, like in US and Europe, there are now a lot of super specialists post MS also. Like there are people who are doing only joint replacements, there are people who are doing only spine surgeries, people who are doing only arthroscopic sports injuries, only doing pediatric and this thing. So after doing your post graduation, your MS orthopedic, it does not mean that that is the end all of what you need to specialize in. You further need to super specialize. You need to take up either whatever your liking is, and that is the time after taking your MS orthopedics. You should go according to your liking, something which you have a passion for doing, something which you feel that you're comfortable in doing. Like if you are very good in doing joint replacement, you can take that. Spine, you can take that. Now, this is for orthopedics, but even after you have taken an MS general surgery, or you have taken a MD gynec, or you have taken an MS ophthal, so those postgraduate degrees by itself are not the end all of your education. After that, you have to take up some super specialization courses, and post that also there are a lot of fellowships also available. Post your MS general surgery, you would require to do your cardiothoracic surgery, or if you want, you can take a urological or a neurosurgery. It does not always depend upon which branch you feel is now in trend or which is most likely to get you a job and all. That is not should be the main outlook. Whatever branch you need to take as a super specialization after your postgraduate degree, you should take depend upon what you like, what you feel that you're most comfortable in doing. Because believe me, there are so many avenues once you take your super specialization to do. You can start your own practice, you can get attached to corporate hospitals, you can become a full-time doctor in some hospital. There are also options to go abroad and all. So the options should not be limited depending upon what is the trend, but it should be according to what is your liking. Now this is for the people who are doing their MBBS and are planning. Yeah, so my motivation was not just to do an MBBS. So in my 10th, and I don't know, I mean, maybe it was the fact that I used to have a feeling that you watching some serials or looking at your surrounding when you have a fraternity where you, even though my parents were not doctors, but we had a close knit fraternity where many of them were doctors. So you used to admire them how they used to work, that they used to be busy even in the mornings, evenings, nights. They used to put in a lot of work. They used to be called up sometimes when they were just going to come for some function or this thing. So that kind of thing, when you're young, when you're in your 10th standard and ninth, you get a little motivated that these guys are little doing some real good work or some hard work. So that was the reason why I decided to become a doctor. And looking at one of my idol who was a neurosurgeon, was a brain surgeon, I thought that this specialty, something related to brain and spine, is looks to be the ultimate one where you will actually be doing a lot of complicated work, a lot of delicate and very fine work, and something which is going to affect the lives of a lot of patients on a day-to-day basis. So that was actually my motivation. And this factors, I mean, if you go through a lot of my colleagues and friends who have become spine surgeons or have become doctors, there has to be some motivating factor for you to take up this thing. Because if you are going to work, say 15 hours, 18 hours, 20 hours per day, sometimes in your residency and post graduation, and even in your work where you will be called up anytime, you'll be attending calls, may have to go for surgeries. Like I've got a very major surgery planned up right now after an hour, which will go on for 7-8 hours. So those things you should be having passion for doing it. It's not just think that okay, this is like a job where I have to go at 9 o'clock in the morning and come back at 5 o'clock in the evening. It's not that. Believe me, with that attitude, you will not be able to go much further in this field. This field is much different from what you're going to do becoming an engineer or becoming a this thing. You should have a passion for it. So, like, I'm a consultant spine surgeon, a senior consultant spine surgeon in Bombay. and I am attached to 5-6 hospitals. Now, the trend in working in major cities in India like Bombay, Delhi, Bangalore is that you have the flexibility that you can be attached to only a single hospital, or you can be attached to multiple hospitals. Now, if you're attached to a single hospital, you become like a full-time surgeon in that hospital. And if you're attached to multiple hospitals, you become a freelance surgeon or a panel surgeon, where you see multiple patients at multiple hospitals and you operate them. Now, there are pros and cons of both of them. It's not that only one thing is good and one thing is bad. It all depends upon what is the surgeon's or what is the doctor's way of doing the work. If he feels that I need to just settle at one place, develop a unit, and I want to work in this hospital, and this hospital looks has got all the factors which are good for me. I mean, it has got a good OT setup, a good OPD setup. It has got a good setup where I can look after the patient post-op, a very good nursing care. Then many of the doctors choose to stay in this one hospital and they progress in that hospital. But if you feel that your super specialty, like I do only minimal invasive endoscopic spine surgeries, and there are very few hospitals in Bombay which have got the entire facilities to cater to this kind of surgeries, and there are a lot of patients who want this kind of surgeries done under them, so they prefer that, being such a big city, that they do not come to only one hospital. So some hospital which is nearby, which has these facilities, they would want to have the surgery or get admitted there. So you can travel there like a panel consultant and get the patient operated there. So you're, as a spine consultant, you have to decide that what is your specialty you're doing. Like I'm focusing on minimal invasive and endoscopic. That is a very niche kind of surgeries that we are doing. And these kind of surgeries, maybe in Bombay, they are being done in 6 or 7 hospitals. So the whole population of Bombay, I mean, the majority of the one who want a spine surgery, if they want to have it done through this kind of approach under me, so they can choose either of these hospitals to come forward. So it's basically depending upon what is your way of working. You may want to stay in a one hospital as a full time, or you may want to get attached to 4 or 5 hospitals as a panel. So the pros are also there, the cons are also there. The cons are that if you're there in one full time hospital, you're not sure that how that hospital can progress. Some corporate hospitals are really very good. They get very good patient flow and they get a lot of patients coming in. So you are sure that, okay, this hospital has got a very good patients who are going to come in the outpatient department. It has got a very good setup where it's catering to everything. The nursing care is good. The costs are not too exorbitant. So the patients don't feel aggrieved and all, that they're not getting a proper care. While if you are working in a this thing, the cons of working in a what do you call a panel, this thing in multiple hospitals are you have to travel a lot. So like you will have to go to 2 or 3 hospitals. You may have to consult or you have to see patients as an outpatient in one hospital and operate in another hospital. So your traveling time increases. So that means that you are going to put a lot of strain and a lot of effort in traveling and doing that. While if you're there in one hospital, you get to just go to that hospital and come back from that hospital. So these are the cons of working as a panel one. The full time,
Yeah.
the cons are that if the hospital is not doing well, if the hospital is not having that much of patient flow, then the surgeon or the doctor feels a little bit insecure. So the name itself is very big, but the surgery is the very smallest thing that is being done. So basically, the name itself gives a little bit of hint what it is. So minimally invasive means something which is very small and which is not that much of a damage causing thing. So as we know, surgery involves, I mean, going through the tissues, going through the muscles, cutting them, exposing them, and then doing the entire surgical part. Now, the people who are in their M.B.B.S. and they would know that the main apprehension of doing any surgery for any patient is that what is going to be the kind of incision, how much is the big surgery going to be, how much time is it going to take, is there going to be a lot of blood loss, is there going to be a lot of muscles which are going to be damaged, a lot of tissues which are going to be damaged. So when you interact with patients in your outpatient, these are the kind of questions that they always ask. So the minimal invasive spine surgery was developed with that outset, that we need to do surgeries which are not going to be too harmful to the patients, are not going to be too morbid for the patients, something which is not going to cause much of destruction of the normal tissues, something which is not going to cause any blood loss or minimal blood loss. So with that idea and with that thinking, minimal invasive spine surgery was first developed in the US, and that was developed with instruments like a microscope, We have got very fine equipments. We have got a navigation. We have got robots. We have got computers. So all these equipments are developed for that idea, so that you can do a surgery. What usually a spine surgery used to be done with something like a 5-inch incision, or say 6.5-inch incision, is now being done by us in something like a, say, 0.5-inch incision, something like, what you would say, just 8 centimeter, 8 mm incision and all. So that is what we are doing. So that is how
Great,
we have progressed from a scientific this thing.
great,
So
sir.
as you know, when you say
So
these things to patients, they start feeling that okay, there is something which is going to relieve their pain, but is not going to cause them problems. So that is a very important point here. So for the doctors, especially in countries like India, we always feel that we are giving a lot of time, we are putting in a lot of efforts, but then the family life is something that we always feel that it may not be given time. So in my case, because I go to multiple hospitals, for my daily schedule from Monday to Saturday, it becomes that you have to start early in the morning because the surgeries are usually in the morning. Then you see the patients in your outpatient department in the evening. So the day goes on very late. It goes on till evening 8 or 10, this thing. But then the days when you have a very light outpatient department, or the days when the surgeries may be cancelled, or where the surgery has been postponed, or you have less number of surgeries, that is the time you should always try to take out for your family. Apart from that, once in a month or twice in a month, always try to make sure that you have the weekends kept away for your family, because the whole month you'll be working. So out of 30 days, 28 days, 25 days, 26 days, you're working 12 hours, 14 hours. So you also require a little bit of slowdown. You also require something of a change of thing. So what we do is once in a weekend, or once in a month on a weekend, we just go out with the family or with the friends. We take time out. Those Saturday and Sunday, we don't see any patients. We don't do any surgeries. And we just go to any place nearby where you are with your family, with your kids and with your wife and your friends, and you are just enjoying. So you basically just need to switch off from what the work you're doing. And that is how each and everyone has to find a balance. And this is very important, because your career is going to be, by the time you finish your education and you come out, it's going to be 30. And so by the time you establish and by the time you finish you retire, it will be 65. So the next 35 to 40 years of your life, you're going to be doing this work day in, day out. So unless you don't switch off, say, once in a month or twice in a month, depending upon how everyone's this thing is. You can take weekend breaks, or you can take weeks break in between sudden of the week when you don't have a surgery planned, or when suddenly, like in Bombay in the rains, everything closes down when it's very heavy. So you can just take a day off and you can just relax. But maintaining that balance each and every once is the most important thing. That will give you more enthusiasm to start doing surgeries when you come back from the break, and that will give you more energy also. Otherwise, after some time, you'll start feeling it is too monotonous, that you're going doing surgery in the morning, seeing patient. So this work-life balance, each and everyone has to figure out how it is, and that after you start in your career, the next 2-3 years onwards, that is what should be your priority. That okay, these days I'm going to work, on this weekend I'm not going to work, and if I'm going to work, I'm going to keep my outpatient department till 8 in the evening, 9 in the evening, or 10, or if I'm going to start in the morning at 7:30, 8 or 9. So when you have those boundaries and priorities set, then if you follow it, then you can maintain the balance very well. So that is the most important point. See, as you are planning for a surgery, the planning involves looking at everything, reports, and looking at the patient, examining everything in detail, and then deciding the plan. But the plan is something that you decide outside. Once you go into the operation theater and once you start doing your surgery, the plans always can change, because you plan depending upon what images you see, what you get the reports, and what the patient has seen. But once you are actually inside the patient, then sometimes the entire thing changes, and then you have to be prepared for that. So if you're not calm, if you're not focused, if you're a little bit agitated or anxious, then you can suddenly get disturbed and you not be able to think forward what to do. So always be very calm, always be prepared that there may be some things which are abnormal. Look at other plans, have a plan A, plan B, plan C, that okay, if I'm going to go ahead and if this does not be like this, what should I do? While initially when you're starting your surgery and all these things, my suggestion is always keep a senior doctor with you. Why that helps is, he has got more experience than you. If sometime when you're doing some surgery and you feel that okay, this does not look to be proper, or I'm having some difficulty, or I'm having some problem, then there is someone senior who can guide you, so you won't get flustered, you won't get anxious. The initial 3-4 years of your career, if you have a senior doctor or surgeon with you when you're doing your work, it helps a lot. And that is what I also did. A teamwork, especially the senior one, helps you a lot in initial. And then as you slowly become more and more confident doing things, you can start doing by yourself. And you can have a junior working with you when you become more senior, so he will help you out when you are doing work, so that you can concentrate doing the more important stuff, while the simple stuff, they can be done by the junior. So see, now, as I said, after doing your post graduation of MS Orthopedics, when I finished, that time still in India, we didn't have that much of a structured fellowship programs for spine. Now in last 3-4 years it has happened, but after finishing my post graduation we didn't have a structured fellowship. Now what I mean by structured is where there is a dedicated fellowship program of a year or 2 years, something which is available in the US, Canada, and in the Europe, that is the UK. So that kind of thing was still not available in India when I finished my post graduation. But since I wanted to do only in spine surgery, you have to look at other avenues. So where you can get your training. Because by itself in India, since we didn't have those fellowships, the only other option was that if you didn't want to do a fellowship or learn spine surgery, you would have to work under some senior doctor for some multiple number of years. And then slowly, as you increase your experience and the doctor gives you his way of doing things and you start operating by yourself, you become experienced. Now that kind of thing has its pros and cons, that sometimes if the surgeon is not very confident on you and doesn't like your work, he may not give you. And sometimes if the surgeon is very open and is very helpful, he may start giving you the work beforehand only. So that kind of ambiguity is there. So it's not very sure that if you go by that way, whether you'll get to operate by yourself, to learn by yourself very soon or not. So since we didn't have any structured fellowships in India, and I wanted to do spine surgery training, so I looked at options where I can start learning this thing. So the options where I could go to South Korea, because South Korea is a country where you can get options to do spine surgery, because even though the language barrier is there, but South Koreans are very technologically advanced in doing the spine surgeries right now. They have got a lot of infrastructure, good infrastructure. The surgeons are friendly. They welcome all of the people who come. They want people to come and see the techniques. They want them to learn, and they make an effort to teach you. So if you give a dedicated time, like I was there for about a year and a half, they develop confidence in you. And if you do work properly, follow the advice, then they know that okay, this guy is very focused in doing spine surgery. They give you a lot of opportunities very quickly, and once you start getting opportunities to operate, to see patients, then you develop confidence quickly. The other thing I went to for very short fellowships in Europe, that was in France and Germany, was because in Germany and France, they don't have a structured fellowships like for a long-term fellowship, like what they have in South Korea or US and the UK. So there you can go for a month, 2 months, or 3 months, because there everything, nothing is paid. You have to you have to manage your own funds for staying and for travel and for everything. The hospital visits and working in the OR and the operation theater is free. That is not something that they charge, but then you have to give money to stay day-to-day boarding. And places like Europe, like France and Germany, are very costly for us Indians. Like if you're in your initial part of your career where you're not earning, and if you have to stay 1 month in places like France, like Bordeaux, or in Germany, like Munich, where you want to learn, it becomes very costly. Even if you're staying in a hostel, even if you're staying in a PG or something like what you have now, Airbnb. So I did a very small focused fellowships in those places. What only those places, only those things which I wanted to learn. Like I wanted to learn only robotic spine surgery, or I wanted to learn only navigation spine surgery. So I went for only 15 days to 1 month fellowship at those places. In US, where there is a structured fellowship, where there is a proper fellowship program of 1 year and 2 years for spine surgery, the preference is usually given for the US students first. The international students, that is the Asian students and Indians, are not given that much of a preference initially. So for you to get a structured fellowship seat in US, you need to clear their MLE exam. After clearing that MLE exam, you need to get a lot of academic recommendations from your home country. Because in US, it's not just the marks which work, they look at the recommendations. So if you have got a lot of good recommendations from good senior doctors in your orthopedic training or in your M.B.B.S, then they make sure that you can get a good seat. So that looks to be very tedious and a very long drawn out process. So people in India have gone, but they have gone only after clearing their MLE, and where they have got very good recommendations, where they may have done some good what you call scientific program or a thesis, and have got good recommendation from that. And on basis of that, when they have got a good fellowship seat in US, they have gone, and then their structured fellowship is there for a year and 2 years. There they pay your entire stipend. You get a lodging also where you have a subsidized lodging and all. So that way you can do for there in US. Same thing in UK. You have to clear that lab and you have to get good recommendation letters, and there you then get a fellowship program. So you have got good fellowships in UK. If you want to do, you can do it in Nottingham, you can do it in Queens. My way of doing it was, since I had not given my USMLE, and since the fact is that my recommendation letters were still in the process of going, I opted to go for South Korea, where you don't require to give a qualifying exam, but they look at your work, they look at what all work you have done, they look at the recommendation letters. And after being accepted through the university, I went to a private hospital called Boridul Hospital in South Korea. There's a phenomenal work of spine surgery used to happen there. There used to be something like 50-60 spine surgeries per day, which is a huge number. And I got a very good exposure, very good background. And after working for 3 months, they knew that okay, started learning the language. They were able to give me work. I was able to see patients by myself in the outpatient department. I used to examine patients once they got admitted in the hospital. I used to work for my fellowship doctor, and he used to start giving me basic spine surgeries, then the complex one, and that is how you progress and become good. Our entire what do you call medical teaching and post graduation teaching is very hands on, patient interaction one. It's not one where we are more of an academic one. I mean, we, like I did from a government hospital my PG, we used to see about 300-400 patients in my outpatient department per day. And this is how our government hospitals work. So you see a lot of patients in your outpatient department, and you don't get time for that academic work. So compared to your US counterparts, colleagues, and your UK one, they have a dedicated day in the week which is dedicated only for academic work. So that particular day in the week, the students and all don't do any outpatient department, don't do any hospital work. They just focus on the research. They get the data, they help the seniors, they get what all tables and all is required, get it all tabulated. So that one day is reserved for them. And that's why if you see all the scientific index journal, majority of the people who are publishing in them are from the Europe, the US, and now from China, because they give a dedicated day to dedicated only for research and academic work, which is not there in India, because in government hospital you don't get time to see the patients this thing. But once you finish your PG, and if you're doing from government hospital, then when you come into your practice, that is when you realize that the academic and scientific work has a much important role to play. So my advice to people who are in their MBBS or in their PGs, try to see. I mean, I'm not saying that dedicate one day in your week for the academic thing, but one day in a month, or say one day in 2 months, try to dedicate it for your academic work. Try to read some good journals. Try to see some new topics which are requiring investigation. Try to see in orthopedics, like okay, if you're working in orthopedics, ask your senior that what is the recent thing that is happening, what is the recent uh, scientific discovery, or what is the latest thing that is happening that people are so excited about. So they may tell you something in joint replacement, they may tell you something in spine surgery, like in minimal invasive spine surgery. So next time when you know, go, and if you are interested in spine surgery, in orthopedic, or in joint replacement, and if your senior has told you about some recent thing which is happening in that, you go to the library or you go online and go to the PubMed thing and see what all latest is happening in joint replacement, what he has told. If he has told about computer navigation, see about thing, what is latest happening. Read some articles about that. Read some scientific journals. And when you get reading about that, you will know that there are so many different researches and so many different papers that are being published. So your focus would be, okay, what more can I do from my background? Like I'm coming from a hospital where I'm seeing a lot of these patients, then what is the different data I can give, what different academic work I can do. So you will then form a framework by yourself, and try to keep a senior involved with you, so he can guide you, he can tell you what important data you can collect, so that it will help you in having a very good scientific paper or a research paper developed. Because if you get a good scientific paper published when you are in your PG, that will help you a lot in getting more recommendation letters, and that will help you in getting a much more good fellowship seat. Spine surgery being a very specialized or a super specialized branch, and I do mainly all my surgeries through minimal invasive endoscopic. So on an average, I do somewhere between 25 to 30 surgeries or 25 surgeries per month. So that would be about a surgery a day, but that does not mean that I operate every day. Some days I do 2 to 3 surgeries. Some days the surgery is not there, that I keep it only for outpatient department and all. So on an average, about 25 surgeries per month is what I do. Yeah, so you don't get paid per hour. It's not like you're working in this thing. You get paid per surgeries. So that's what I'm saying. Like if you're working in a full time in a hospital, you don't get paid per surgeries. You get a remuneration at the end of the month, which is a fixed salary. And if you have crossed that something with your monthly income, then you get whatever extra you have earned. While if you're working as a panel consultant that is in multiple hospitals, you don't get a fixed salary. So whatever work you do in that hospital, maybe some patients which you have admitted, you have seen in the outpatient department, you have operated. So the end of the month, whatever is the work that you have done and whatever the charges are the hospital has decided, that charges are calculated. There is certain taxation, certain fees which the hospital deducts. And after that, whatever is remaining is what you get as a check at the end of the month or at the end of 2 months. Once you finish your post graduation, that is when you start realizing, and if you're doing it from a government hospital, that is when you start realizing the amount of patients that are there, amount of problems that they have. And that is when you start feeling that okay, it is not possible to get emotionally involved with each and every one, because each and every one is at a different level. Some people are having a lot of financial problems with their medical problems. Some of them having so advanced medical problems where it is not possible to totally get them better. Some of them are having a lot of other mental problems, mental issues, their stress along with them medical problems. So you see a lot of gamut of patients which are happening, and these things are varied. So when you do your post graduation and when you start the initial part of your career, that is when you start realizing that these kind of things are seen on a day to day basis, and you become more emotionally strong because you have to interact with them, have to tell them what is their problem, have to understand if they have any financial problems, any stress problems, any other family problems. So when you give time to them and understand these things, you start becoming emotionally strong, because you know that you have to treat only the medical problem. You have to have a very clean mind, you have to very what you call clear mind. You should listen to all their other problems, try to understand what is their main thing, focus on treating their main medical problem. All the other problems that they have, give them a good sympathetic ear. Try to suggest them if you have a stress that okay, maybe you can meet some other doctor, a psychiatrist or a psychologist. If they have some financial problems, you can suggest them how they can go for treatments which will be affordable or comfortable to them. And if you have some other family problems, you can maybe try tell them that okay, get your family members when they come for a next consultation, so that you can also apprise them of this thing. When you are doing all of these consultations on day-to-day basis and seeing 30-40 patients per day, you start realizing that you have to become emotionally strong, because your main focus is you have to treat the problem. You don't have to focus on treating the other things, because if the patient gets treated from his problem, then he will feel more satisfied, he will have trust in you, he will be knowing that okay, his main problem has got better, and I'm confident on the doctor, and I will follow what all other things he's saying regarding my stress problems or my family problems, and he will listen. So be strong, focus on treating the problem for which the patient has come, try to diagnose for what he has come, main thing. The patient develops confidence in you in this way only, and with that, treat him properly in the most economical and affordable way which you think the patient can do. It does not mean that if the patient is a very genuine general ward patient or a patient who is very poor, we should prescribe him very costly medicines. You try to see that what is his affordability. If the patient is not very affordable, no need of giving very strong, very this thing, give him very proper affordable medication. And that will make you emotionally strong, because all these factors, when you do on a day-to-day basis, it develops a perspective of treating only the main problem for what the patient. So basically, an open spine surgery by itself does not require a lot of equipments. So it's not that costly. While a minimal invasive spine surgery requires to use a microscope, other computer navigation and all. So those devices, since they are used on a more frequent basis, the cost of surgery goes up in that. But having said that, since these equipments are purchased by hospitals, it's not that they're charged very exorbitantly. And that's why we have ways where we can reduce the cost of these things for that the patient's burden is less. And many of the patients who come for us, the surgeries nowadays, they got their Mediclaim or insurance. So all of these things are covered by the Mediclaim. So their burden as such is reduced. Yeah, people who wear glasses, they can very well become surgeons. In fact, a lot of the surgeons who are there, they have glasses because they have studied such a lot and they have come through a long career way of doing. So with glasses, it's not a problem unless it's a very heavy glasses that without glasses you can't see anything and this thing. But otherwise, with glasses, you can very well operate and all. Now, regarding the shaky hands, now is it the shaky hands because you are afraid of something, or is there a medical condition that needs to be investigated? If it is something because you're anxious or you're not confident in all things, once you start doing surgeries under the guidance of someone and then doing under the supervision of someone, you become confident. It's not that everyone is a born surgeon. Like I was not a born surgeon. It's not that from day one I knew what to operate. I observed what my seniors did, then I was supervised by them, then I was guided by them, and then I became independent doing it. So initially I was very hesitant, I was not that confident, but slowly become confident. You can do what all surgeries you want. So if the shaky hands is because of that, you will definitely get better. There is no harm. If there is a medical condition, like people who have hypothyroidism, they have a little bit of tremors, or people who may be a little bit having tics and all, that is the thing, then you should consult a doctor. There are some medications which needs to be started. Those medications will help you in curing this condition, and after that you can operate. When you are operating, you have good cases and you have bad cases. The outcomes where you expect would not be so good, but then the patient becomes really good. So let me see. So maybe a month back, we operated on a boy about 13 years old, and he had a very badly crooked spine. And we didn't expect that we would have such a good correction of the spine or making completely straight. But it was a very long surgery. It went on for about 6.5 to 7 hours, and post that surgery we observed him for about 2 3 days in the ICU, and then he was in the ward. And then after his dressing was done and everything was fine, and when we made him stand and walk after 4 days, and his mother was really very surprised. I mean, she was like totally crying, seeing how straight he had become. I mean, from getting completely bent to become completely straight and able to walk. And a 13-year-old boy for whom appearances and this thing make such a lot of difference. And the boy himself was so thankful and so happy that he had become completely straight, that he could now go back to school with a straight posture. And so that was a very memorable day, which is the recent memory which I remember. And there are some really bad memories also, some surgeries where you didn't put in a lot of effort and you expected that the patient should really do well. Patient somehow did not do well, was deteriorated, and somehow progressed, and the outcome was not bad. So when those things happen, they create a little bit bad things and it lingers in your mind, because what was how do you keep emotionally available? We keep emotionally available, but when these things go on a level where you put in a lot of effort and suddenly something does not go bad, for that particular day or two you feel emotionally bad. You feel that okay, you should have put in more efforts or something different, and then you get upset and you try to get everything sorted out, and then you get better. Main thing is that if you have taken all the precautions before the surgery, done all the investigations, explain to the patient the type of surgery, and everything is explained and the patient has full faith. But even after that, if something untoward happens during the surgery, like has some bad outcome or does not, patient does not do well, then it is not because on your part you have lacked something. You have taken proper care, you have done everything, but it is something where it was certainly unforeseen, it has happened something which you were not prepared and all those things. So in such cases, you need to make yourself understood that okay, you have taken all the precautions, something has happened which was totally out of your hand, and that 1% of thing is definitely not your hand, and you have to make yourself consoled or make yourself understood with that thing. Once you have made yourself understood that okay, it's nothing of your thing where you have not done, you have taken all precautions, you have explained to the patient and all things are fine, but it's happened this thing, then you try to analyze that what has gone wrong, that why did it happen, that okay, maybe something was there which we have missed, and where maybe the next case when we are doing, we should take this precautions and this thing. And then that is how, when you're emotionally very sound, you are able to look through those things and find out what is the problem and make sure that the next time this thing is not happened. So you know that this case, okay, what you wanted, that outcome did not come, even after taking your best of precautions, doing all those things possible. So whatever thing which was not done properly, if you try to analyze and find it, the fault in that thing, even after best of thing, the next case when you don't do it, you will get a very good outcome. So in spine surgery, the emergencies are less. It's not that we have a day-to-day basis, but you get sometimes, like once in 6 months, you may get a spine patient who has had a fracture and who comes to you, and then you need to operate in the night with some this thing. So it's very rare. It's about once in a 6 months that I get such a call to operate in the night. Otherwise, most of the times these are all planned surgeries. These are the surgeries that you do planned in the morning or in the afternoon according to the time that is there. If you decide to become a surgeon, first of all, you should have the passion for doing that thing. So that means that no matter what time of the day you're called initially of your career, no matter if you have to work 12 hours, 14 hours, 16 hours at a stretch without maybe having to eat properly or sleep and all, you should be able to do it just because you like doing it. That's your passion. So you should have a passion for that thing. So if you like that thing, no matter what amount of work or efforts you put in, you will not be tired, or you won't be feeling, okay, this is too much, I don't want to do it, this is too bad and this thing and all. Secondly, you should have a very good temperament. You should try to see things that, okay, the initial part of your career, you should be humble. You should learn things, learn from your seniors, the way they are managing their time, the way they are managing the cases, see how they're seeing the patients, see how they're operating. Be very observant, be very humble. The initial 5 to 6 years of your career is going to decide your character and to decide how you progress in your life. Try to learn. So when you want to learn, observe. If you see something which is not proper, which you see something which is abnormal, ask the surgeon that why are you doing this? What is needs to be done? So always get things sorted out when you're in initial part, so that it will help you in understanding the things, learning the things. If you have any doubts, be free, be open, ask your senior that, okay, you did this thing, I did not understand why you want to do it. Where should I read about this thing? Be prepared for things. When you are asked to go for a surgery, when you are asked to assist a surgery, always try to read 5 minutes of that surgery. Try to learn some important points of that surgery if you get time. So that when you're in that surgery, when the surgeon or the doctor is explaining to you, you will try to understand that what is happening. You're not totally blank. You won't know that, okay, what is happening? I don't know. He has to explain to me everything. Be humble, be observant, be very, have a good temperament, learn from your seniors. So this is all that is required in the initial part of your career. Secondly, you should be ready to put in a lot of effort. You should be hardworking, because believe me, once you put in all the hard work initial part of your career, after some time your life can become pretty smooth. Then you will have people who will be willing to work for you. You'll have fellows who will work for you. So with that, you can have a much more better quality of life. But the initial part of the life, you have to put in good hard work. So my advice to you all is, see, medicine nowadays, we read a lot of things in papers, all those things happening and all. But you should not go by that. It's still a very noble profession. It's still a profession where you are there in day-to-day interaction with patients. And believe me, no matter what all these things we read in the newspapers, people are genuinely believing that a doctor is the one who is going to solve a lot of their sufferings and their problems. So with that belief, you should have a passion in doing the work. You should not look for your monetary gains. You should not look how successful you'll be in career. You should not look at what all wealth you'll accrue. That all things, definitely everyone will get it once you become successful. The main thing is that you should like it. You should be feeling that, okay, I need to do something so that I can help this patients or help this thing. It may be that you may have got this thing after looking at your family members or friends, but whatever you get it, try to develop a passion in becoming a doctor. Don't look at any other benefits in becoming that thing. So when you start learning and when you start becoming a doctor with that idea in mind, you will really like what all things are told you. So no, no matter if I had to work 14 hours or 16 hours in my post graduation, I didn't mind it, Even if I had to sleep 1 hour or 2 hour daily, or if I didn't get any time to eat also in the whole day, I didn't mind it, because at the end of the day, I knew that I had learned something at the end of the day. My experience had become bigger. And this is how you should be. You should, the initial 5 to 7 years of your career, your post graduation, after that 4 years, you should not think about gaining anything. You should be just thinking about gaining an experience, learning something, developing good rapport with your colleagues, developing a good contact with your seniors, so that when you establish yourself, these are the people who are going to help you a lot.